and collaboration technology, considerations for nursing leaders. I'm Carlene Anto, Vice President of Marketing for Perfect Serve, and I will be your moderator today. Thanks again for joining us. Before we get started, I want to take a moment to review today's webinar platform with you. In the middle of your browser, you'll see a box containing today's slides, and they will advance automatically throughout the presentation. If the slides are hard for you to view, please make sure that you expand your browser. To the right of the slides, you'll see a Q&A box that can be used to submit a question at any time. Your questions will be addressed at the end of the presentation. And finally, at the lower right-hand corner, you're going to find a resource list containing a PDF of today's slides that you are welcome to download, as well as a related white paper and case study. Just as a couple of reminders, today's webinar is being recorded for our friends and colleagues who are unable to join us live today. As an audience member, you are in listen-only mode, so please make use of that Q&A box to communicate with our speakers. And finally, at the conclusion of the webinar, we ask that you complete a short survey and tell us what you thought of today's event. Today, we're excited to hear from two great speakers. Corey Wirtz is the Chief Nursing Officer at Mercy Healthcare's St. Rita's Medical Center in Ohio. And Michelle McCleary is the Chief Nursing Officer here at Perfect Serve. And at this point, I'd like to introduce Michelle.
Thank you, Carlene. Just a bit over 3 years ago, the Gartner Healthcare Analysts identified a new market, and they termed it clinical communication and collaboration, otherwise known as CC&C. And since that time, the definition has been somewhat honed, but basically it is composed of mobile systems and services that have been designed to improve care team communication and care coordination. And while secure messaging is a salient feature of this technology, it actually has capabilities far greater than that, such as patient assignment functionality or schedule management capabilities and interoperability with the EHR and other healthcare IT. Now, before you, for those who may not be familiar, is the Gartner Healthcare Technology Hype Cycle. It actually traces the various phases of an introduction of a new technology or innovation to that of mainstream adoption. And you can see the location of CC&C technology on that hype cycle. And it's projected that CC&C solutions will reach mainstream adoption in just 2 or more years. And in fact, in the most recent publications by Gartner, they recommended that healthcare organizations adopt a CC&C solution as a critical patient care delivery initiative and technology program. And they recommended that this occurs in the next 1 to 2 years, as this needs, from their perspective, to be a higher priority on an organization's roadmap, because they see it as providing the foundation upon which more sophisticated patient experience and care team collaboration requirements can be built. And so as more and more healthcare organizations purchase and deploy a CC&C solution, we thought it would be helpful to review those lessons learned by the earlier adopter healthcare organizations who have already gone through this process deploying such a solution, the considerations, best practices, and pitfalls to avoid. To start the process, it's really necessary to have the appropriate framework, and simply that is the recognition that communication in healthcare is broken. You are painfully aware that poor communication is a contributing factor, if not a root cause, of over 80% of all sentinel events that occur. And there are long-standing recalcitrant obstacles and challenges that have been well documented to degrade care. And one recent survey found that such obstacles include, as a care team member, I don't know who is the right person to contact for the particular situation at hand. And so I spend an inordinate amount of patient care time searching and struggling and attempting repeat calling, repeat paging, just trying to connect with the right person. And then unfortunately, all too often, I contact the wrong person and I need to start that process again. And all of which, as you know, delays patient care as well as patient transition and discharge. And so we know that these problems become exacerbated when attempting to communicate outside the walls of the hospital and across the continuum. And what's really important to understand is that patient care and all patient care initiatives are dependent upon communication-driven workflows. And if you launch an initiative, it will falter, if not fail, if built upon this broken system. So another best practice that we learned from the earlier adopters is that it is never too soon to establish governance. The sooner, the better within this process. And that entails the formation of a multidisciplinary, cross-functional steering committee. And it's so important to have representation across the entire organization's ecosystem to really prevent that pitfall from focusing on the needs of one stakeholder group to the exclusion or detriment of another. For example, focusing on a nursing mobile communication solution and choosing one that may not support physician or other care team members' workflow. And it is the responsibility of this steering committee to develop a comprehensive CC&C strategy that needs to be inclusive of all those stakeholders' needs. And this will prevent the pitfall from simply choosing a fragmented point solution, such as an alerts and alarms management product, which isn't supporting the broader communication and collaboration goals of the entire organization. And importantly, not only should this strategy be inclusive of the immediate needs of the organization, but also the future direction and projected growth of that organization as we see care transition outside the walls of the hospital. And from that comprehensive strategy, then the steering committee will be able to identify core capabilities. And those are the foundational, fundamental capabilities that are going to target those known obstacles and challenges that I just discussed. And in that way, you are ensuring that you are going to build your initiatives and future feature functionality upon a solid foundation. For example, one core capability is dynamic intelligent routing. And that is the automatic identification and immediate connection to the right care team member for that particular situation at hand. To do this, all of the work group workflow rules, as well as the multiple call schedules across multiple facilities, and the personal contact preferences are gathered from each practice as well as each work group, and then incorporated into an intelligent routing algorithm for each. So at the time of a communication, all of the variables of that situation are analyzed in real time in order to direct that communication to the right person. This eliminates that need to search and struggle to find out who is the person to contact and how do I contact that person, as well as it eliminates that opportunity for error of contacting the wrong person. Another such, with this capability, and this is key, it can reduce communication cycle time. The time that it takes for a communication to be initiative to the receiver to respond to the same. And in this example that you see before you, the average communication cycle time was reduced by almost 70%, from an average of 46 minutes down to 14 minutes. And importantly, it also dramatically reduced the number of times of repeat calls, because if a person is immediately responding, then I don't need to call again, leave more messages or pages, as we've already connected. Another core capability for consideration is cloud-based architecture. And this allows dynamic intelligent routing as well as other capabilities to easily be extended across the entire ecosystem of that organization. So that ability to automatically identify and immediately connect with the right person regardless of their care setting. And with that, it reduces the support and maintenance that is required of your traditional client-server architecture. And on top of that, it is designed for no downtime, and it maintains all users, all care settings on the most recent version of software. Now, once you've established this firm foundation that directly resolves those communication obstacles that exist today, then that allows you to build deeper feature functionality that may target specific stakeholder needs as well as initiatives in your own time frame, based upon your own needs and your own budget. And with that, I will ask Corey to share her personal experiences as an early adopter of the CC&C solution.
Thank you, Michelle. As Michelle alluded to, my name is Corey Wirtz, and I am currently serving as the Chief Nursing Officer at Mercy Health St. Rita's Medical Center in Lima, Ohio. I have been with this organization for 17 years. I absolutely, truly believe in the mission and vision values that we have here, which is the reason I stay. In addition, in my tenure here, I have held many positions. I started as a new grad in the ICU on nights back in 2001. I worked on the telemetry floor. I held a position in IV team. I have held many different manager jobs, supervisor jobs, spent a couple years focusing on patient experience. And most recently, within the last 8 months, have had the opportunity to serve as the Chief Nursing Officer. I tell you my journey and my story because I think it's powerful from the standpoint that I've had the opportunity to experience Perfect Serve as both a frontline nurse with direct patient contact, but also as an opportunity to interact with Perfect Serve and use it from the nurse leader standpoint. And so offering you both of those perspectives gives you a well-rounded view of what Perfect Serve has to offer. As I alluded to before, I started in the ICU as a new grad back in 2001. At that time, my nursing education did a fantastic job of preparing me to take care of the patient at the bedside. But what it may not have done was offered me that opportunity to learn how to function in a hospital. As we know, nurses can function in many different roles in many different places, and our nursing schools teach us how to take care of patients. But oftentimes there's a gap in learning how to function in a hospital. And some of those functionalities that nurse serves as at the bedside is a clear communication hub that nurse pulls together from all different aspects of the care that's provided to the patient. And as a new grad in the ICU, that was probably one of the most anxiety-provoking things for me to experience. So not only did I have to manage 2 very critically ill patients for 12 hours, but to learn how to navigate a call schedule, physician call schedule, paper call schedule at 2 in the morning. And oftentimes I found myself clearly, as Michelle alluded to before, increasing that cycle time for communication by simply trying to fumble through the paper call schedules and find out who was on call first, when I had a critically ill patient and a critical value to share with that physician. At that time, I was frequently finding myself also maybe calling the wrong physician at 2 o'clock in the morning. And as we all probably have experienced before, those calls aren't fun to get on the receiving end to learn that unfortunately you've paged the wrong physician. In 2004, our organization entered into a relationship with PerfectServe. At that time, I still had direct patient contact and had the opportunity to be an early adopter and to learn to use PerfectServe from the front line. And it was a godsend. The technology that was available to us from PerfectServe allowed us to take that paper call schedule and virtually eliminate it at the time. And so the nurse at the bedside, in my experience at that time, allowed me to pick up the phone, know that I was caring for Dr. Smith's patient, and be able to dial one number to either get a hold of Dr. Smith if I needed him, and PerfectServe took that burden off of me to have to navigate that paper call schedule. So I was able to just dial Dr. Smith, and PerfectServe would route me directly to either Dr. Smith or whoever was on call for him at that time. And so as PerfectServe grew, and as we grew, we both grew together. And as their capabilities got better, so did ours. We were able to move from having one single number assigned for a physician to being able to pick up the phone and say Dr. Smith. And at that time, then PerfectServe would route us to either Dr. Smith or the physician who was on call for him. To most recently, within the last 5 years, we've had the capability of a web-based platform. So I could type in a message via PerfectServe, and that message would automatically be sent to Dr. Smith or whoever was on call for Dr. Smith for a return phone call. Most recently, in the past year, we've had the opportunity, I believe it was in May of 2017, to interact using bidirectional texting. PerfectServe offers us that capability, which has increased immensely that ability to immediately communicate with physicians and other providers who are on the care team taking care of the patient. And so that's really been my journey as the nurse at the bedside. And now fast forward to 2017, where I've taken on the role of Chief Nursing Officer. In the last 8 months, I've had the opportunity to experience PerfectServe and to work with them advocating for that nurse at the bedside. And I've learned a few things about the nurse leader role in this capacity. As I alluded to at the beginning, absolutely nurses are the hub for clinical communication and collaboration. We are obviously the glue that holds the team together. And our ability to be able to quickly tie that communication together for the patient, to advocate for the patient, to ensure that the patient gets everything that they need, and to do it quickly is essential in our job. As the leader of the team and as nurse leaders, we have that responsibility and critical role for setting the stage and processes that facilitate that communication and really advocating for that nurse at the bedside. Our job, and I take it most seriously, is to make their jobs easier. I truly believe that in my heart of hearts. And leveraging technology as we move forward is absolutely key to creating an ease of use for the nurse to be able to coordinate and collaborate with the healthcare team. If you are a nurse leader and you're in the nurse leader role, you are probably no stranger to unfortunate outcomes that at times happen for our patients. And when you peel back those layers of the onion, most frequently what I find is that it is communication breakdown. And so at the heart of it all, it is our responsibility to make that communication easy for the bedside. And leveraging technology is absolutely the way to do it. What also our responsibilities are is obviously that creation of policies and processes surrounding that clinical communication and the use of the technology to protect the nurse, to protect the patient, and to protect the provider. And Perfect Serve has absolutely served as a key role in this area in ensuring that we are creating those policies and processes to support the nurse and the provider in those communication interactions. And so if you're considering entering into a relationship or advancing your clinical collaboration technology, here's some considerations that I would offer you from having gone first on both sides of the fence as a staff nurse and as a nurse leader. Number one, if you're considering any sort of change or project, obviously support from the highest level of leadership is an absolute must. On a previous slide, what I had alluded to is back in 2004, our relationship with Perfect Serve began, and that effort was led heavy-handedly by our CMO and our CNO at the time. It took a team. It still takes a team today to ensure that those policies, processes, accountability starts at the absolute highest level. And we're ensuring that we include all the stakeholders, much as to what Michelle alluded to, in that process to ensure that communication happens. Bullet point number 2 and number 3 really go hand in hand. So creating a steering team that's really focused on outcomes. So if you're considering propelling and moving forward, ensuring that you have a team, a multidisciplinary team with key stakeholders at the table that's focused on results, and results such as reducing that cycle time for clinical communication for the nurse at the bedside and for the provider. And then surrounding and putting some teeth in and some accountability around ensuring those results happen is an absolute must-have from the team. Number 4, you must be culturally ready for change. If you are a healthcare leader of any sort in the healthcare world of today, change is no longer a four-letter word. We absolutely embrace it and move forward. And you must ensure that the organization and the people that you have are ready for that change, and ensuring that you can incorporate those key stakeholders, they understand the process, and not only with their head but also with their heart. So they have to believe that they're going to make a difference by using this product and improving that communication throughout the use of Perfect Serve. Number 5, I think, is absolutely extremely important, and that's ease of use and support of the product. So many times in the nurse leader role, I find myself looking at opportunities to improve either patient care, nursing care, provider care, and the number one question I always ask myself is it easy to use? Because I believe we can all agree that if it's not easy, they're not going to use it. And we are absolutely here to facilitate their role and not hinder it, not to put up another barrier. And our experience with Perfect Serve is that it is an absolute easy product to use and easily adaptable on both the provider and the nursing side. And support of the product. So that requires, obviously, if somebody's having a problem and it's 2 o'clock in the morning, that there's going to be somebody to help that clinician who needs something to take care of their patient. and who's going to support them. I can tell you from experience as both a bedside nurse and a nursing supervisor that every time that I have 24/7 reached out to Perfect Serve for that support, they have been there to facilitate that conversation with the provider, and we've had absolute support of that product. Finally, cybersecurity is an absolute consideration. Here at Mercy Health St. Rita's, we're part of the Mercy Health system across the state of Ohio and Kentucky, and we have a very stringent cybersecurity policy, and so any interaction from a IT perspective that involves patient information goes under a stringent review process. And I'm here to tell you that if Perfect Serve can pass our cybersecurity test, they can pass about anybody's. And I think it's an extremely important consideration, not only for the fact that we need to protect our patients, but also we need to protect our clinicians when it comes to interacting in that communication capacity. What I did not allude to here is something else to consider is that after you've made the selection and decided to proceed forward with perhaps propelling your clinical communication technology forward, it's absolute a necessity that you stay focused on continued and sustained value. And some of those things that might help and that we do here currently are regular meetings with both myself and our current CMO and Perfect Serve. And we meet on a quarterly basis. We stay focused on cycle times. We stay focused on what providers and what nurses are using it on a regular basis, the number of times that they're responding, how long it takes to respond, and other metrics to keep us focused that we are staying on track with easing that communication between the provider and the nurse. In addition, the use of Perfect Serve in this technology has just become who we are. And so I think staying focused on processes, on surrounding onboarding. In nursing orientation, it is absolutely an expectation you will use this as well as physician communication. So if you are coming on as a provider here at Mercy Health St. Rita's Medical Center, there are no questions asked. We sign you up. This is how you will be communicated with and how we will manage your call schedules. And what I find as we move forward is that providers and nurses are both thankful that we have taken that route with the clinical collaboration technology because it allows that collaboration to take place and it's easy to do. And they both want it to be easy to do. And so, Michelle, I believe I'll turn it over to you to talk to us a little bit about vendor-provider strategic partnerships.
Thanks, Corey. Just briefly in closing, if you are considering the purchase and deployment of a CC&C solution, know that you are not on that journey alone. Select a vendor who can serve as your strategic partner, a continuous collaboration throughout the entire process from the point of selection to, as Corey had referenced, sustained, continued, and added value, where there's shared expertise and resources and competencies for mutual benefit. Together, you can map out what technology can support your new and emerging needs. And as care changes and transitions, you can help the vendor understand what are the new challenges that you face. And that will help direct our development to ensure that we continue to deliver a product that will best meet your needs, plus offer the potential for great innovation together. So Carlene, I will turn it over to you for questions.
Thank you, Michelle and Corey. That's awesome. Let's take a moment to answer a few questions from our audience. As a reminder, there is a Q&A box to the right of the slides that you may use to submit a question. Our first question is, what did you do to foster nurse and physician adoption and continued utilization of the technology? That's for you, Corey.
Sure. So I will rewind 14 years ago to where we began the using of the technology. What I remember the most about that time was, number one, literally the paper call schedules disappeared. So we did our education. We ensured that we had champions for both nursing and providers who were readily available when we went live with the use of PerfectServe. And at that time, it was absolutely a must-have that our old paper call schedules disappeared. And so, for lack of a better term, we kind of ripped off the Band-Aid and just held people accountable to ensuring we were using the product. But at the same time, we also supported them by having champions available and readily available around the clock. So if somebody got stuck, we were there to help them.
Awesome. Okay. Our next question is, could you please provide an example of the policies and processes that best support and protect the nurse?
Sure. So I think what comes to mind the most is within the last about 3 years, we've developed the Physician Safety Advisory Council. This is a physician-led group, and we were having some issues at that time with callbacks and the length of time it would take for a physician to call a nurse back. With the help of PerfectServe, we were able to identify that length of time and an average length of time. Took it to the Physician Safety Advisory Council, who could see the data, the very telling data, and the group advised that, you know what, as a medical staff, we believe that if it's important enough that a nurse reaches out to us, we must respond within 10 minutes. And so that's just an example of a process that we had set up here that PerfectServe helped us implement and ensure that we were able to hold people accountable to.
Nice. Okay. Our next question is, what have been your greatest challenges in the deployment of a CC&C solution?
The one is probably the most recent, would be our bidirectional texting, which we went live with about a year ago. It was great technology, and both the nursing staff and the physicians were very excited about it. However, quickly we learned, and what we knew prior to deploying it was the inability to text orders. And so what we had to learn, what we had to from the nursing standpoint was, you know, when do I text and when do I call? And some of those decisions still need to be made. There are just things that you shouldn't text because obviously you're expecting an order. And so it was, for lack of a better term, don't bait the physician because the physician can't send you back an order. It was more of this one is reserved for a phone call, this one is appropriate for a text. We've been using it about a year now. We've gotten better at it. We're certainly not perfect at it, and occasionally we'll run across an angry physician that says, well, don't text it to me if you can't take the order by text. Pick it up and call me, and so we're still learning how to navigate through that.
Yeah, that makes sense, though. Okay, the last question I see so far is, what do you wish that you would have known then that you know now?
Probably, hands down, would be including a group of physicians on our steering team. So I alluded to you about a couple of questions ago about our Physician Safety Advisory Council. That has actually only been adopted within the last 3 years or so. And we've had a relationship with PerfectServe since 2004. And I would probably suggest that you have some sort of physician council or physician-driven steering team that absolutely is with you from the beginning of the journey. It was championed by our CMO. He was very involved, but much like nursing, you must involve that front line also.
All right. Well, I think we've reached the end of our questions. I don't see anything else in the queue. So this concludes today's webinar. Thank you for spending your very valuable time with us today. We hope that you'll take a moment to complete our short survey and tell us how we did. You should see a survey icon at the bottom of your screen, which you can launch manually if the survey doesn't automatically launch for you right now. Again, thank you for your time, and I hope you have a